Okay, so today we are going to discuss the results of our screening tool and our steps going forward. So we chose our patient. Her name is Julia Landivar. And the reason that we chose her is because her values in flexion, especially, um, were lower than the normative data values. Um, so it should be noticed that we did active range of motion measuring. So it was all her. We did not intervene at all. So for active range of motion, the normative data value was 148, so between 147 and 149 degrees in active flexion. But with her, she was in the lower 130s for both of our measurements. And so that's where we draw concern. And we've come to learn from her patient history that she was actually in a car accident a few months ago and has been concerned about how it will affect her playing in tennis competitions because she has experienced pain, especially in her wrist. And from the same journal in which we found our normative data values, we also discovered that elbow range of motion impacts the load upon the wrist joint. So with all of this in mind, our ultimate goals are to improve her elbow flexion through the means of developing range of motion of the elbow joint and also alleviating her wrist pain. But we do have specific patient goals.
And before we dive into goals, since we have 3 stages, and so therefore each stages will last about 8 weeks. And before the stage begins, we will do a baseline measurement, and then at week 4 we will do a midline measurement, and then on the 8th week, which is the final week, we're going to do a final measurement um, for each stages. And we'll be mainly focusing on the range of motion of flexion, but since everything can, like all the measurements can be deferred, we will also be looking at extension, pronation, and supination. So therefore, we're going to be measuring extension, flexion, pronation, supination at the first week, and then the 4th week, and then the final week. And to dive into the short-term goal, our first short-term goal is to improve the patient's range of motion through passive means. Um, by the 4th week, we want her to reach 140 to 143 degrees of flexion, and on the final week, we want her to reach 150 to 153 degrees of flexion. And the second goal for us to improve Julia's range of motion through active means with controlled minimal resistance. And we want her to hit 137 to 140 on the 4th week, and then to hit 147 to 149 on the 8th week. And for the long-term goal, we want to improve Julia's range of motion through active means with controlled maximal resistance. And the final goal for that will to help her to hit upper 140 range in flexion. And lastly, the most important goal for us is to minimize and eliminate pain at Julia's wrist. Um, we are planning on doing this by building strength in the muscles of the elbow joint, and we are gonna alleviate the strain that's put on the wrist joint by improving elbow range of motion by both active and passive means.
So to kind of reiterate everything, we're going to have 3 stages: passive range of motion, active range of motion with minimal resistance, and active range of motion with maximal resistance. So our passive stage, we are going to do the baseline measurement, the midpoint measurement, and then the final measurement of all 4 components: pronation, supination, flexion, and extension. But we're specifically, again, going to be focused on flexion, but we want to keep track of everything else just in case other issues arise. And along with measuring flexion and extension, in reference to one of our long-term goals, we're also going to give her a pain scale of 1 to 10, 1 being little to no pain, and then 10 being like extreme pain. So after she completes the exercises in the passive and active stages, she can log that for the ultimate goal of during those stages, finding ways to minimize that pain, so that when she's actually in competition in a tennis match, when she reports afterwards whether or not she felt pain or not, for it to be in that lower range or just absolutely none. So now we will discuss the exercises we have for our passive stage.
So for the passive range, we're going to be doing some stretches, and the stretches are going to be focused on the elbow joint. And we're like, what the goal for the stretches is to increase the shoulder mobility and flexion, and just like relax those muscles on your elbow joint, and then kind of like increase the muscles or like the strength of the elbow joint and the wrist joint.
So after we transition from the passive stage, in which there will be some sort of like intervention when it comes to Julia moving, whether it be like her propping her arm on a towel or pillow, or someone mobilizing her joint for her, or a band, we're going to move to active stages in which she is going to be producing the motions herself. So our first active stage, which is our second stage of the whole program, is going to be active range of motion with minimal resistance. So some of the exercises that I have listed are tricep dips, hammer curls, skull crushers, barbell curls, and a pronation and supination exercise. And we're going to make separate videos or a separate video detailing how to do the exercise and the amount of reps. But the point of these exercises is to develop all the elements of range of motion for the ultimate goal of improving flexion. But for the minimal resistance stage, we're going to have her start with a predetermined resistance band, just so it's maintained throughout the whole process. But once we transition to the active maximal stage, we will start her with a baseline weight, with the hope that during the 8-week process, at least once a week, she can continue to add weight on. So for example, with the barbell curls, the first week she may just be starting with the bar, but our hope next week would be that she would add 2.5 pounds to every side. And with that in mind, it will help us determine what force causes her problems during flexion and extension. So if she hits a certain weight value and she can't completely flex, then we know, okay, we need to move her to a different weight, and she needs to really develop the strength for that one weight before she can move to the next stage. So that is our video on the education of findings, our patient goals, the interventions we have planned. Once again, we're going to have separate videos detailing how to do the exercises and the amount of reps and breaks that need to be taken in between and how many days they should be done.